Yes, thank you, Ty. We're here live in Big Flats, where County Executive Chris Moss is going to be giving us the latest in the fight against the coronavirus. Let's take a live listen in.
Good afternoon. I want to thank you all for coming. With the holiday weekend upon us, we thought it would be a good time to have an update where we could talk about the testing, vaccination. There's been some new governor rules that are going to be forthcoming that we wanted to review with the health department director to see which direction Chemung County is going to be going. Yesterday's numbers, as you can see, maybe I'll let Pete talk about them a little bit. We are seeing them going in the correct direction that we wanted to see them go for months, Pete.
Yeah, it's very, I think, reassuring right now to see that, the messaging and the hard work of the community. We had the community involvement over the summer, and we were able to flatten the curve and stabilize our numbers. Then we had the big uptick starting around Labor Day. We saw those extensively high numbers. In the interim, we did see a small spike around Thanksgiving, or after Thanksgiving, same thing for Christmas and New Year's. So it's nice to see that the numbers are going back down, but again, we still need to practice our public health prevention, with the separation distance and mask use. We're close, as we start to roll out more and more of these vaccines. We get closer to that light at the end of the tunnel, but just want to stress that it's still not time to abandon social distancing and mask use.
And if you looked at tests completed, I mean, would you have thought we've been at 160,000 tests at this point in time? So that's a fabulous job by our health department and others, our community partners. So correctional facility numbers are obviously good. Hospitalizations, we'd like to see them continue to trend downward, but that's really our only concern right now on the dashboard. Pete, I'll let you talk about a couple of the graphs we have here. First one.
So we decided to change things up a little bit and kind of go through some of the state information. So if you kind of look at this, and this is from yesterday, right from the state dashboard. If you look at statewide, 34 million people have been tested. And then if you kind of look at these bars here, this is Chemung County. What I wanted to kind of bring up is if you look over on the side there, it has Chemung County at 6,225 total cases. And if you just remember from the previous slide, our report from our dashboard is 6,233. So we've been dealing with a lot of questions over the entirety of COVID about why are our numbers different. I don't know if the numbers are trying to stabilize or now the state is more in line with the numbers that we're getting. But that was just privately something I thought, oh, geez, finally things are starting to work out a little bit. But if you look at that, still the testing, the health department has scaled back its testing a little bit, to accommodate the vaccination efforts. But you're still looking at, for the most part, 800 or more a day, and then with those other low numbers. So we're still seeing a good number of tests being done with lower positives, and that just does help lower that percent positive rate. So this graph, percent positive over time. So this is the state graph, and this gives you a good idea. You can go all the way back to the start of COVID. In March of 2020, and kind of see where that's been. You see our big uptick, and it matches it with the testing. In addition, it'll show you the blue bars are the total people tested. The yellowish area at the bottom is the total tested positive, with the orange being the percent positive test. So if you look at that, and again start seeing our spike as things move around, you get a good idea of where that's going. We're going in the right direction. We want to keep that up. So again, we want to keep with our public health prevention efforts.
This is off the statewide dashboard, and obviously everyone in the Southern Tier region, which includes our adjoining partners, Schuyler, Gates, Tioga County. If you look at our 1.1 7-day rolling average, it's the lowest in the state right now, which is phenomenal. And our hats off to the Finger Lakes region as well. A month ago, they were spiraling out of control. They're down to 2.8, and Western New York down to 4.0. So, the numbers are trending statewide in the right direction, Pete. And obviously, that's probably one of the reasons the governor has started to loosen up some of the restrictions involving the reopening process. So, again, Southern Tier region's done an excellent job, lowest in the state as of yesterday. So hopefully we can get that under 1% in the next week or so. Vaccination information continues to be the #1 call we get at the health department, Office of the Aging, the county executive's office. Everybody wants to know information in reference to the vaccine, as they should. And I would again caution them, please be patient. as we continue to receive the vaccine in small doses, and I mean, 200 a week or 300 a week, it's very hard to, take care of a population of 80,000, but everybody's doing their best. Right now, a total of 10,000 Chemung County residents have been vaccinated as of February 9th. That's pretty good. So we're over 10% of our county population has received the vaccination. What you need to remember is that not all these vaccinations have taken place in Chemung County. There are people traveling outside of Chemung County and the southern tier to receive the vaccination. Our health department alone has done 1,074 first doses, 400 second doses, so they've done a good job there. And again, you have to remember, we have partners, local pharmacies such as Rite Aids, Gerald's, Arnott Medical. They're also administering the vaccine. So when you look at that 10,000 number, a lot of those numbers come from obviously combining. I think the Arnott's probably received the most vaccines, Pete, to date since week one started. And an estimated 300 additional doses will be administered by the Chemung County Health Department by the end of this week. So obviously our numbers will continue to increase. We've been receiving around 200 to 300 doses a week. Obviously, we'd like to see more. We were on a call earlier this week with the governor's staff from the health department, Dr. Zucker and Larry Schwartz, and we're anticipating by week 10, I believe it is, to receive an allotment of doses that were earmarked for the Arnott will come to the local health department as we expand the category of people that we're allowed to vaccinate. Look, we also get the question, why are you doing the school districts first, or why are you doing this group first? We're trying to prioritize. Obviously, our main goal that I discussed with Pete are 65 and older individuals with pre-existing medical conditions. And the reason is, over the last year, we've seen these folks are the ones that end up passing away from getting COVID because their immune systems just can't fight it off like somebody who's younger. So obviously, at the end of the day, we want to make sure that the main focus is 65 and older and individuals with pre-existing medical conditions. But with that being said, you also have to remember that the governor's office and the New York State Health Department is dictating who can be vaccinated by who and when. So, for instance, hospitals are taking care of healthcare workers, essential workers, and 65 and older. So the health department hasn't had the opportunity to vaccinate people 65 and older because we're not allowed to do so as of yet. Pharmacies are taking care of people 65 and older. So folks that are signing up at Rite Aids and Gerald's and CPS are normally 65 and older. And then the health department has 1B, essential workers, and not all essential workers are included in the group at this time. So, I mean, there's a lot of people to be vaccinated. There's a lot of different groups and organizations, so we're trying to prioritize it. Obviously, we've been contacted by restaurants. Well, we're told that our folks can get vaccinated. Can we do that now? So, it's Pete's job to weigh, should we be going after people that have compromised immune systems, or should we be vaccinating bartenders? So, I mean, it's really an easy question with an easy answer as far as I'm concerned. We have to focus on folks who have compromised immune systems first and then work our way backwards. But we try and prioritize with the health department as best we can. Starting 2/15 Monday, local health departments will be allowed to vaccinate those with underlying health issues referred to as comorbidities. So this is the word of the week from the Department of Health and from the governor's office, and what we want to share with people. So as the local health department starts to schedule more people in 1B, these are and Pete, maybe you could talk a little bit about the comorbidity that if people have these types of issues, they can get vaccinated under 1B now?
Correct. And I think it's important, when we talk about, I don't think anyone would be surprised by looking at the immune-compromised list, or immune-compromised individuals on the list: severe obesity, sickle cell, diabetes, neurologic disease, cancer, heart conditions. We have a lot of chronic illness in Chemung County. So I think it's excellent that they're opening up the ability for the local health department to vaccinate people with these comorbidities. They're more at risk, as county executive said earlier. They're the ones that are more likely to succumb to severe health outcomes and even death. So I am pleased to see that the state has opened that up, and hopefully will provide enough additional allocation to begin really making strides with these groups of people.
One thing we did want to talk about is obviously when you do anything, there's there can be fraud involved, or people can come and say, well, I have one of these comorbidity issues, I need to be vaccinated immediately. There are different guidelines under which the health department's allowed to go ahead and give the vaccine for comorbidities. We chose the signed certification as opposed to making everybody go to their doctor's office and bring a doctor's excuse saying, I have high blood pressure, I can go ahead and get vaccinated. Pete, maybe you could talk a little bit about what the signed certification would mean and why we went that route?
Sure. So currently, if you obtain a vaccination through the health department, we have you sign an attestation form developed by New York State, and that has on there, how you are enrolled in that through 1B. We're going to adjust the attestation form to include these comorbidities. We don't want to know what they are. You just take a look at the list, and you sign that you attest that these are true, you have a comorbidity. We went that route because, it's not only that the person would need to bring in either a pill bottle, a note from their doctor, or some kind of document from an electronic health record. That'll put a lot of pressure on medical providers in the hospital, too, as a lot of these individuals call them en masse to get this paperwork. Then it's incumbent upon us at the clinic to wade through that stuff, decide what's what. We feel that this is the best way, and ultimately we want to get the shots in people's arms, so we feel that this is the best, most efficient way to get these to the people that need it in the community.
We are working on a mobile vaccination unit. I met with the health department earlier this week, so obviously that will be our next goal. We realize there's a segment of the population, just can't get to a vaccination site, so our goal will be to take the vaccination to them. But again, there's only just so much we could do with the shortage of doses that we receive. But we are working on that so that when the state increases the amount that we're receiving on a weekly basis, that we can send a couple of nurses and somebody from clerical out to different locations and get folks vaccinated. So we haven't forgotten about these folks, and obviously we would like to go to retirement centers and those types of places and take the vaccination to them. But again, we can only do what we can do with the amount of doses we're receiving per week. A lot of questions coming on the New York Forward program as the governor continues to reopen the state to different venues. Obviously, the big one we're looking at right now, wedding receptions. So what's happening here is it's all been put on the local health department. So we've been receiving calls since the governor announced that you could have up to 150 people, at a wedding reception. It's really going to task the health department with having to review a number of applications, probably having to do a site evaluation. Then we're going to have to figure out how we know that the testing was done 72 hours within the event. So it's just, more work continues to be thrust upon, the local health department with limited resources. So we are working on this. We haven't gotten the specific guidance from the state as of yet, I don't believe.
Nope.
But we just have got the parameters of some, how it's going to work. But we have gotten dozens of calls from folks who want to go ahead and get their wedding reception set up. So all we're doing is waiting until we get the plan from the governor's office so we can start reviewing them and so forth. So if you do have a wedding reception you're planning in the next couple of months, we would ask you, obviously, you can start working on your plan now. There's a template plan on New York Forward. I imagine the majority of the questions will be the same as any event that's being planned. Received a couple of calls. Is the first arena going to open? The first arena is not a large sports arena. When the governor announced this yesterday, this is for large sports arenas. So you have to have a minimum of 10,000 capacity seating, and I believe 10% of that capacity is being allowed, but we do not have one of those in Chemung County or our area, so it does not affect the first arena. School sports. I can't say enough about the great job done by our school superintendents and our athletic directors. They worked very well together countywide to get their sports up and running again. Both the public health director and I were very impressed. We were going to look at fans being allowed on February 15th. I believe we were going to reevaluate it. We're going to push that back at least 1 week because of the snow days they had last week. Everybody got off to a slow start of getting the kids back and so forth. So it'll probably most likely be the following week, and we'll look at fans being allowed. Some schools are for it, some schools aren't for it. What we're trying to do is standardize our decision amongst the southern tier regions. So we talked with Schuyler County, Steuben County, Broome County, Tioga County, just to make sure that everybody's going to be doing the same thing. But hats off to the school districts; they've done a great job, and they've also done a great job self-policing, not only the issue of having sports start back up, but with the testing, they've done a phenomenal job. So there's never been an issue there. And at the end of the day, what it's going to come down to is testing. So even as we look at larger events, wedding receptions, People are going to want to open, summertime's coming. We have the farmers markets. We have Tags Event Center. So we're getting a lot of questions. Will the governor eventually decrease the amount from, a center that can hold 2,000 people or 3,000 people? We don't know that yet. We don't get that information ahead of time. But I would tell folks to plan. And I think the biggest part of this plan is how are we going to conduct testing? So, for instance, if we had an arena here, somehow we have to figure out how to conduct testing within 72 hours of the event. So those are going to be the next challenges that we face. How do we test a large number of people who are going to attend a concert in the town of Big Flats and make sure that, we've given them the credentials, that they can prove that they've been tested, who's going to conduct the testing, is the price going to be added to the ticket? I mean, there's just a lot of questions that are going to be asked. But you know what, we're hopeful with the light at the end of the tunnel, with the vaccine, that we're going to start seeing some of the smaller events allowed to open as well. So with that being said, we'd be more than happy to take some questions. Yes, sir?
Executive Moss, you just spoke on that. You don't know how you guys are going to work on that COVID testing for these live venue events. Do you think you guys could take a lesson or two from what Governor Cuomo and the Buffalo Bills did with that 72 hours, just lining up maybe somewhere like the Chemung County Fairgrounds and just one after another after another? Is that something you guys are looking into?
Well, I guess number one, we have to figure out who pays for it. Does the person, so if it's added to your ticket, is the event organizer going to end up having to pay for that? Because you're talking about, and Pete can speak to it better. Pete, if we wanted to test 2,000 people to get to an event, how long is that going to take us, and how many your staff would it take up?
If we're conducting rapid tests, that's 15 minutes a pop. So if however many hours 2,000 people equal, and then we still have I think 9 ID Now machines. We also still have some of the Binax cards, which they don't need the machine, but they're still limited by that 15-minute wait time on there too. So that would be quite an undertaking. It could certainly be done. Smaller numbers would be better. Another thing to keep in mind about testing, this isn't something that someone can just do. So if a facility wanted to have an event and wanted to test themselves, these things have to be done per the executive order, under either a lab director or a nurse or a doctor or something of that nature, and then it has to then be entered into the New York State Eclair system. So these facilities would have to team up with either the health department or a medical provider, Cayuga Medical, Arnett, something like that, in order to make that happen. That's why it's become such a big question for us, because the testing need doesn't go away just because we're able to start opening things up, because the numbers are getting a little bit better, and that we're starting to focus on vaccinations. The testing is still a big need there. So, that's still something that we're talking about how to do it. In addition, we're really reliant on supplies from New York State. So, again, we could be in the same boat we are with vaccines, where we may want to test 500 people, but maybe we, as the health department, only have 200 test kits. So a lot of things to figure out moving forward.
And it's a great question, because we've seen the numbers after the Buffalo Bills home games where they allowed fans. The numbers did not increase, most likely because of the testing being done. So testing is going to be a key component. So it's going to be imperative that we figure out how to do it for, not for venues as big as that, but for our local venues. Yes?
Chris, it seems like the county's been getting 200 or 300 doses a week from the state, which obviously, as you say, is inadequate for what you really want to do. Have you gotten any kind of hint from the state as to when they're going to be able to start increasing that amount?
I've been involved in several meetings with the governor's office, along with my counterparts across the state, where they've indicated that they're going to be giving more doses to the county and be more reliant on the counties throughout the state to get the process done. So we're hopeful sometime soon that we'll be receiving, the number of doses where we can ramp up our MaxVax facility right down the road and run 800 to 1,000 a day. So, that's what we're set up for. That's what we'd like to do. But, understandably, the state can only give us what they have as well. So they give us what they get from the federal government. But if Johnson & Johnson gets approved and we get some of these other vaccines approved through the process, hopefully we can get it done by summertime and get back to life, more normal.
When you talk about the comorbidities, you said that would be coming on the 15th. Now, there's already individuals in this very community that are vocally frustrated that they can't get their hands on a vaccine and get those vaccines in their arm. Now that we're inviting more individuals to apply for these vaccines, are you worried about these individuals, like more people going under the radar that really need these vaccines?
I mean, certainly there's people that are being missed. You know, Pete's office, my office receives calls every day from folks who either can't get there or they have these pre-existing ailments and they want to get the vaccine. So it is an issue, and maybe Pete can talk about it a little bit more. I mean, we try to do the best we can and get to the people who we think need it. And again, we have the pharmacies assisting, we have Arnett Medical assisting, and you know, the health department is another conduit. But it's very hard to stay within the parameters that the governor gave us of who we can go ahead and give the vaccine to, and not everybody's operating under those same guidelines.
And the other thing to keep in mind is we've worked on, you know, we have our own system for registering people for vaccinations, and you know, to our best effort as we try to stick within that framework so that we're only vaccinating those people, and we're ensuring that only the people we can vaccinate get the vaccinations. As we've tried to send the link, it gets compromised quickly. So what that has caused us to do is kind of take a step back and take a more active role in who's getting vaccinated or who's getting registered for the vaccination at that point. So that means sometimes it's the health department staff that say, okay, I have your information, you qualify, let me enter you into the system. It's not really intended to be that way, but it's really the only mechanism we have right now to ensure that the people who qualify for those vaccines, you know, get registered. So as we move forward, we're still working on, you know, how to streamline that, how to make that be more efficient. The county executive and I, we know better than anybody. We're as frustrated as everybody else. We spent weeks developing our max vaccination site, and we have been practicing with the staff right now. In fact, just today, we upped our hourly rate to 96 or 104 with the goal to get to that 144 per hour. That's our 1,000 a day if we work a full day shift. So we're practicing each week and getting better and more efficient at these things. And when we can get more of that vaccine, you know, I really see a good opportunity for us. But it also causes us to have the need to reach out to these groups. I reached out to several groups today. We're going to keep doing that for several reasons. One, we want to build a nice alternates list. You know, that's what you guys have probably seen it in other places where they have no-shows, or maybe they have 8 extra doses at the end of the day that they have to use. So by having an alternates list of people you can call, you know, then that's better than going around the corner to 2 people you don't know and saying, hey, I got 2 doses, I got to give them, you know, do you want them? By having that alternates list, we're still getting the vaccines out, and we're still getting to them, to the people that they need to go to. In addition, by working with our community partners for those people in comorbidities, you know, we're also going to reach out to medical providers as well to help us. You know, we can target those communities, but that's really going to be the only way we can do it going forward with the low number of vaccines.
And you also have to keep in mind we're having a hard time with our black-brown population. When you look at the numbers, fewer of them are being vaccinated. And, you know, so last week we worked with Libertad and EOP and Faith Temple Community Church because the governor sent what was originally, we were told, was going to be 500 doses specifically for that segment of the community. Ended up being 200 doses. But, I mean, both organizations did a great job. And where Pete talked about, we send them a link to get their folks signed up. You know, it works great because if we just open it up on the news, you know, it just fills up immediately, and it might not be the demographic that the governor's office is looking for. So unfortunately, a lot of our black and brown population aren't in segment 1A because they don't have the job titles that were, you know, that were listed in 1A. So we, you know, it just never ends attempting to reach out to the different segments of the population that we need to get vaccinated. And that's a problem across the state. So we're working with the governor's office on the pop-up clinics as well.
Got another question too. So we talked about earlier that Dr. Anthony Fauci was saying how by April it's going to be open season with vaccines. Do you guys see that as a possibility, or do you think that's kind of a long shot?
Pete, I'll let you answer that. I don't know.
It would be nice. County executive mentioned it earlier. We go back to the first slide. We fought so hard to get testing into the community. I would have never thought we'd be at 160,000 tests by now. So if we apply that same reasoning to the vaccine, if they can open up the production and get it to us. But remember, you know, this allocation comes from the federal government to the state, and then the state gives it to the municipalities or to the counties. So the last update for information that I received yesterday was there's approximately 10 million people in New York State eligible for vaccine. And New York State's receiving 300,000 from the federal government each week. That rate's going to take a very long time. So I'm as hopeful as anybody. It would be great if they could take that off, and if the same if the same thing applies to maybe the testing, then maybe 6 or 8 months from now, when we're standing here talking, I can point to another slide that says, "Wow, look at all the people we vaccinated."
Yeah, I mean, we're ready to do it. We just need the doses. Once it comes, we have the means to administrate it. So hopefully we'll get it. If we get it by that time, that'd be great.
And lastly, I know we give you guys a hard time. We're always asking more and more questions, but you know what? We see the southern tier continually, one of the lowest numbers across New York State. Is Governor Cuomo's office at least reaching out to the Chemung County Health Department or to you, County Executive Moss, to see what they can be doing to help get those numbers down? Because Finger Lakes really is right here, and a lot of the times we are seeing the Finger Lakes numbers spiking.
So that's what we do in the regional control room. So the governor's office has regional control rooms set up across the state. We're obviously in the southern tier region. We talk with our southern tier partners on a regular basis. I'm either on the phone with Jason Garner from Broome County, or so there is good communication. But again, look how long we went with very low numbers when this started out, and then first week of September, I mean, look what happened. We went right off the edge of the cliff with those numbers. So I don't think we were doing anything different. We had a spike at a church. We had some issues at a college. I mean, and then it just, it got into community spread, and we couldn't stop it from there. But the fact of the matter is, I don't think people just stopped wearing their masks at the beginning of September, and then all of a sudden the virus came here. So I think we've done a good job, not only in Chemung County, but throughout the southern tier. I think the percentages obviously allude to that. And you know what, I hope the best for all the other surrounding regions, and it looks like everybody across the state is going in the right direction right now. Anything else? All right, we want to thank everybody for coming. We want to thank the public. Again, please, just because you got your vaccine doesn't mean that you don't have to wear a mask. We keep getting that question. Someone thinks they got their second dose. And real quick, Pete, could you talk about the second dose? Sure. We have had some calls where some folks have felt poorly after receiving the second dose. And Pete, maybe you could just touch on that a little bit.
So the data from the CDC has, and they have their site has a nice fact sheet on what to expect after the first dose and the second dose. So, we were told, beforehand, be on the lookout for a second dose. We're seeing, some cases of headache, body ache, chills, things of that nature. And certainly we're definitely seeing that. So it doesn't mean that you have contracted COVID. Keep in mind, over the course of the 28 days for Moderna and 21 days for Pfizer, you've elicited an immune response from your body with a foreign entity. So keep in mind, that's your body actually doing what it's supposed to do. But just so everybody is aware, there is a chance that you could have body aches, chills, headache from that second dose of the vaccine.
Does it matter though if it's Moderna or Pfizer? Are people still getting sick the next day after their second dose?
I can say from what's listed on the CDC, it's similar advice given for both. For us here in Chemung County, since from the county health department standpoint, the majority of what we've given has been Moderna. That's what we focused on. We've only administered 200 Pfizer doses. So that's what we've been, I think, more keyed into.
Okay. We want to thank everybody. Have a great long weekend.